Welcome to the Loving Support WIC Peer Counseling Training Program for WIC managers, coordinators, and supervisors. This training has been developed through a cooperative agreement between the USDA Food and Nutrition Service and Every Mother, Inc. It is designed to help state and local WIC agencies implement and sustain successful peer counseling programs that help participants in the Special Supplemental Nutrition Program for women, infants, and children receive the help they need to reach their breastfeeding goals. The training program for WIC peer counseling program managers, coordinators, and supervisors provides program guidance based on the FNS Loving Support model, research on the evidence behind peer counseling, best practices adopted by state and local WIC agencies across the country, and solutions to address common challenges. State and local agency showcases are also included to highlight successful strategies. The curriculum is divided into 10 major sections. Each section is important for training new managers and for staff in existing programs to assure continued best practices in program management. Each section has an accompanying notebook and handouts. Feedback from participants during in-person training indicated the notebook was an extremely valuable resource. Both the notebook and handouts are accessible on the Maryland WIC SharePoint website. Please print each notebook section and the handouts prior to viewing the webinars so that you can follow along, take notes, and reference handouts as they are discussed. Welcome to Section 6, Scope of Practice. This section addresses roles and responsibilities of peer counselors, scope of practice, and referral networks for WIC participants experiencing problems beyond the WIC peer counselor scope. At the end of this webinar, WIC managers will be able to identify the general scope of practice for a peer counselor. You will want to have the handouts entitled Peer Counselor Job Description and When to Yield available for reference during this webinar. Peer counselors are an important adjunct to WIC program services, expanding the breastfeeding services of the local agency. The local agency staff provides appropriate education to participants and refers to peer counselors. Peer counselors supplement but do not replace the work of CPAs and lactation professionals. In this webinar, we will explore how peer counselors fill gaps in service. They can devote the time to help mothers explore their barriers and concerns, and they are available outside the usual clinic hours. Peer counselors provide basic information and support to new moms to support normal breastfeeding. They make referrals to designated breastfeeding experts, such as IBCLCs, when they experience problems beyond their training. Based on information from friends, family, social media, and parenting magazines, mothers, especially first-time mothers, often have unrealistic expectations about what breastfeeding will be like. New moms often feel overwhelmed and that they are doing something wrong. They might not have had information or education shared with them during pregnancy about breastfeeding or normal newborn behavior. When the baby is born, they might encounter hospital routines that do not support breastfeeding. Peer counselors fill these gaps in services by providing prenatal breastfeeding promotion and support to mothers, helping them visualize how breastfeeding can work for them, by connecting WIC mothers to other health programs and services that can help during pregnancy and beyond, by preparing mothers for what to expect in the early days of breastfeeding and encouraging them to attend prenatal classes, by calling or visiting mothers in the hospital to help them with early concerns, by following up with moms when they get home from the hospital and making referrals to the WIC designated breastfeeding expert as needed, and by providing ongoing support as the baby grows to help mothers feel confident with breastfeeding as new questions arise. Research shows that prenatal counseling with WIC participants can have a significant impact on a mother's infant feeding decisions. Peer counselors help mothers explore their individual barriers to breastfeeding throughout the pregnancy, as the mom's feelings about breastfeeding may change. They help mothers prepare for the hospital experience to get breastfeeding off to a good start and connect them to sources of support. Research completed as part of the WIC Infant and Toddler Feeding Practices Study 2, Intention to Breastfeed, shows major shifts over the last 20 years in WIC women's beliefs and acceptance about breastfeeding. Pregnant WIC women are more aware today of the important reasons to breastfeed and are less likely to believe negative aspects of breastfeeding. This helps explain why the breastfeeding initiation rates are at an all-time high among both the general population at 80% and the WIC population at 73.1%. In 1995, only 60% of all U.S. women initiated breastfeeding. We have made huge strides in the last 20 years. However, we still have room for improvement. Breastfeeding duration rates decline quickly, and exclusivity rates are far below the recommendations of the American Academy of Pediatrics. Healthy People 2020 goals are to increase exclusive breastfeeding rates at 3 months to 46.2% and at 6 months to 25.5%. The CDC National Immunization Survey shows significant disparities across racial, socioeconomic, and educational lines. These statistics were shared in Webinar 5, Staffing Considerations. Studies show that prenatal education is linked to longer breastfeeding duration and exclusivity rates among low-income populations. This is especially true when education helps prepare mothers for breastfeeding and helps them prevent and manage early concerns. Research shows higher breastfeeding rates with high-intensity peer support initiatives that include monthly contacts beginning early in pregnancy and more frequent contacts as the due date approaches. Most women make their infant feeding decisions during pregnancy and often before their first contact with a health professional. Decisions are often made during or before their first trimester of pregnancy. Research also shows that women who initially plan to formula feed can change their minds when they receive information and support from a peer counselor. Teen mothers, who typically have lower breastfeeding rates, are more likely to make their initial infant feeding decisions much later in the pregnancy or in the early postpartum period. Peer counselors play an important role in helping the teen mother make an informed decision, helping them prepare for a positive hospital experience, and connecting them to sources of support. Peer counselors who were themselves teen mothers can be important role models. Agencies with significant teen mom populations should consider recruiting peer counselors who were former teen moms and had positive breastfeeding experiences. Breastfeeding support begins by establishing a relationship with the mother before her baby is born to help build trust and confidence. Peer counselors who meet regularly with moms during pregnancy have the opportunity to build relationships so the participant feels empowered and confident working through concerns that might arise. Peer counselors report it is difficult to build a relationship with someone they have not met and cannot see. Peer counselors should be encouraged to see new mothers for in-clinic visits so that they both have the opportunity to associate a face with a name. Research has shown that younger moms who text more than talk also like to know that there is a real person on the other side of the phone and feel more connected when they have met that person face to face. During the early first few days postpartum, peer counselors are an invaluable link to help and support new mothers. Many postpartum women who initially intend to breastfeed return to WIC for formula after delivery. Peer counselors play a critical role in filling the gap in services a new mother experiences after hospital discharge and before her next appointment with the pediatrician or the WIC clinic. The CDC reported in its Morbidity and Mortality Weekly Report that 6 out of 10 women do not meet their breastfeeding goals. This can have long-term implications on infant and child health, as longer duration rates are associated with improved health outcomes. Lactation is a time-sensitive physiologic process that is impacted by experiences in the first hours and days after birth. Research shows that unsupportive hospital practices and policies make it difficult for women to continue. Mothers who deliver in hospitals with unsupportive practices and policies are 8 times more likely to discontinue breastfeeding. When phone calls and visits to the hospital are allowed, peer counselors help mothers with some of these early concerns. They offer support and make appropriate referrals to the WIC-designated breastfeeding expert. Peer counselors talk with mothers about basic issues such as positioning and latching the baby, how often to feed the baby, how to tell the baby is getting enough milk, tips for success, and helping mothers see what is normal. Research supports frequent contacts with new mothers in the early days, every 2 to 3 days in the first week or so, and within 24 hours if the mother reports problems with breastfeeding. At the time of this recording, Maryland WIC has submitted an updated policy and procedure to reflect these new contact guidelines. While we await approval, please continue to follow the contact guidelines listed in Procedure 1C, Documentation and Contact Guidelines. CDC data from the National Immunization Survey shows that the biggest drop-off in breastfeeding exclusivity occurs within the first week. Mothers are recovering from pregnancy and delivery. Their hormones are dramatically shifting, and postpartum depression can set in. Many mothers feel vulnerable and unsure of themselves. Mothers are often fatigued and might be in pain. Family pressure to switch to formula can be intense. Most women doubt their ability to make milk, and this is true for WIC moms as well. They interpret their baby's fussy or newborn behaviors as a visual sign that they are not making adequate milk and need to supplement with infant formula. According to the 2016 CDC report card in Maryland, 20.5% of newborns receive formula in the first 2 days of life. Research among WIC women shows that the demands and stresses are great in the early days. The WIC Infant Feeding Practices Survey reports that 1/4 of new WIC breastfeeding mothers begin supplementing formula before the first week has ended. Half have started supplementing by the end of the second week. Peer counselors are trained and are prepared to discuss the most commonly reported issues for supplementing and weaning during this period: concerns about milk production and painful or uncomfortable breasts. Peer counselors are a lifeline to new mothers during this critical weaning period. They help mothers know whether their baby is getting enough and yield her immediately if she is struggling. They offer her encouragement and support to continue breastfeeding during this transition period. Scale-up programs with more phone calls and hospital visits provide more intensive face-to-face assistance and are encouraged if agencies have funding available. During the first month, new mothers are establishing milk production and adjusting to the new demands of motherhood and breastfeeding. Peer counselors continue to offer ongoing help and support during this critical period. Peer counselors can promote exclusive breastfeeding and the WIC food packages for fully breastfeeding mothers and answer common questions mothers have. There is a large gap in time between the first pediatrician's appointment after discharge from the hospital and the next pediatric visit or WIC appointment, typically about a month. The peer counselor may be the only support a new mother has during this crucial time. The new mother is building her milk supply and needs encouragement and information to reassure her things are going well, or get them in to see the IBCLC if things are not. Peer counselors help mothers gain confidence and encourage them if family members and friends are not supportive. Some peer counselors conduct simple weight checks in the WIC clinic. This can help reassure new mothers that their baby is doing well. If the mother's concerns are not alleviated or if weight gain is inadequate, the mother should be referred to the WIC designated breastfeeding expert. We need to differentiate routine weight checks from clinical pre- and post-feed test weights. Clinical pre- and post-feed test weights are not within the scope of practice of the peer counselor. These should be conducted by the WIC designated breastfeeding expert or other lactation experts in the clinic. NSA funds must be used to purchase scales that will be used by staff other than peer counselors. Contacts with new mothers should continue frequently during the first month. Weekly after breastfeeding is going smoothly, and within 24 hours if mothers experience problems. Frequent, regular contacts will help mothers gain confidence they are doing well. They allow peer counselors to address changing situations that may affect the mother's perceptions about how breastfeeding is going and help the mother gain access to the IBCLC when needed. After the first month, as the baby grows, mothers continue to have questions and concerns, including returning to work or school, a primary factor in early weaning. Peer counselors continue to offer ongoing help and support. This includes helping mothers work breastfeeding into their lives. If mothers are returning to work or school, peer counselors encourage them to continue breastfeeding, help them find creative solutions for expressing milk when they are away from baby, and help them access breast pumps. They also help mothers deal with basic challenges, such as breastfeeding in public, managing and nursing baby with other activities, and dealing with challenges of older babies, such as started solids and teething. Peer counselors promote the WIC food packages and make referrals to WIC designated breastfeeding experts, nutritionists, or other sources as necessary. They also connect mothers to other mothers in the community for support. Beyond the first month, peer counselors in most successful programs initiate calls or contacts with new mothers monthly, as long as things are going well, and around 1 to 2 weeks before the mother returns to work or school, and a day or two after she returns. Once breastfeeding is well established, mothers continue to have questions and issues throughout the course of lactation. Without peer support, they often rely on advice from family and friends or from the internet. Focusing contacts with mothers before and after they return to work allows them to give guidance tailored specifically to the mother's work situation and to prepare them for their return to the workplace. Research shows that most breastfeeding women wean their baby within the first month after they return to work, so this is a critical time period for support. Some WIC agencies might find it difficult to follow these ideal contact guidelines if funding is limited. In setting priorities for contacts, WIC programs must have all components of the loving support model in place and seek to target peer counseling services when participants need it most, such as the third trimester and first month after birth. FNS advises agencies to use funding to ensure a high-quality program, even though the number of women they can reach or the length of time services are provided may be smaller. These guidelines should be followed when setting priorities in your agencies. The State Breastfeeding Peer Counselor Program Coordinator is available to meet with your agency and assist with this process. Meet with clinic staff to devise a system to streamline referrals and make the most of peer counselor hours. Assure that the WIC clinic structure has clear referral protocols so that peer counselors focus their hours on basic information and support. Examine the clinic appointment system and determine ways to improve efficiency for peer counselor contacts. For example, consider scheduling pregnant women on the same day so that the peer counselor's time is more efficient. Explore group education opportunities. Many clinics issue food package benefits at the end of these classes to encourage attendance, and peer counselors often assist by providing breastfeeding education. Examine other ways to help peer counselors meet participants. In some clinics, the CPPA calls the peer counselor for an initial contact with a pregnant woman or breastfeeding mom who is being certified. Explore text message options, including automated texts timed for certain pregnancy weeks or postpartum periods. Prioritize early postpartum and late pregnancy contacts over early pregnancy contacts. Collaborate with local hospitals to encourage improved hospital practices. When mothers get off to a good start, less time will be needed by peer counselors to address challenges. Please refer to the handout entitled Maryland WIC Breastfeeding Peer Counselor Job Description during this section of the webinar. The Loving Support Model states defined job descriptions for peer counselors. The job description for peer counselors outlines their scope of practice. Other useful documents include Maryland WIC Peer Counselor Training Materials, the Breastfeeding Protocols, Maryland WIC Cardex, and When to Yield. For additional questions regarding the Breastfeeding Peer Counselor scope of practice, please contact the State Breastfeeding Peer Counselor Program Coordinator. From the Maryland WIC Local Agency Peer Counselor Job Description. The peer counselor will treat each participant with respect, warmth, and kindness. Always keep in mind that the decision to breastfeed is an individual one and that each person has a unique experience with unique needs. Maintain strict confidentiality of all contacts and WIC records. Attend work, meetings, and trainings at scheduled times. Submit an accurate timesheet to the peer counselor coordinator on the date required. Adhere to State of Maryland WIC Breastfeeding Peer Counselor Program policies and procedures. Follow designated breastfeeding peer counselor protocol guidelines. Counsel WIC pregnant and breastfeeding mothers by telephone, in person at clinic appointments, during group classes, and/or support groups at scheduled intervals as per WIC policy and as determined by the local agency breastfeeding peer counselor coordinator. Provide basic breastfeeding information and support to pregnant and breastfeeding women utilizing approved WIC materials. Provide assistance in facilitating successful breastfeeding and help in handling and preventing common breastfeeding problems. Document and maintain accurate records in the information system. Refer any questions or concerns beyond the scope of the peer counselor training as established in the protocols and Maryland WIC program breastfeeding cardex to the breastfeeding peer counselor coordinator or designated local agency breastfeeding specialist. Follow state, WIC, local agency, health department if applicable, and other facility rules and regulations. Attend employee orientation that may be required by these facilities. Provide referrals for infant and child problems that may include, but are not limited to, breastfeeding or medical issues that deal with a sick, premature, failure to gain weight, nutritional, social, medical, failure to thrive, or neurological impairments. Provide referrals for conditions affecting the mother such as alcohol, drug, nutritional, domestic violence, emotional, physical, social, medication use, or illness. Assist local agency in the promotion of breastfeeding and breastfeeding peer counseling through special projects and duties. As assigned, participates in continuing education related to lactation. What is the scope of practice and why do our peer counselors need one? The Loving Support Model states peer counselors have a defined scope of practice that supports normal breastfeeding. Medical and allied healthcare providers and other health professionals all operate within a defined scope of practice. A scope of practice describes the range of activities practitioners are permitted to perform and is based on their education and training. A scope of practice aligns with the terms of professional licensure. This helps protect the provider and the patient and clarifies referral protocols. This reduces liability risk and helps everyone know what to expect. Although a WIC peer counselor is not a licensed medical professional, a defined scope of practice helps everyone know the situations in which peer counselors can provide services and the types of information they give to help reduce liability risk. The peer counselor scope of practice is based on the FNS Loving Support Training curriculum for peer counselors. The focus of the curriculum is on supporting normal breastfeeding. Peer counselors provide basic information and support as detailed above. The State Breastfeeding Peer Counselor Program Coordinator is available to answer questions and address any concerns regarding peer counselor scope of practice. What is the role of the WIC designated breastfeeding expert? The Loving Support model states the peer counselor needs timely access to a WIC designated breastfeeding expert for assistance with problems outside of peer counselor scope of practice. Peer counselors should not provide services beyond their basic scope of practice. Instead, peer counselors should have access to a WIC designated breastfeeding expert, DBE, to handle complex breastfeeding problems. DBEs can be WIC staff who achieved advanced lactation training and experience, such as an IBCLC, or a contract professional in the community. See Section 3, Program Planning, which outlines NSS guidelines. DBEs assist in situations such as premature infants recently discharged from the NICU, infants who are not gaining appropriate weight, babies who refuse to breastfeed, mothers recovering their milk supply, infants transitioning from supplementation to full breastfeeding, infants who are failing to thrive or who have congenital anomalies, mothers with hormone conditions, mothers with previous breast surgery, mothers with sore nipples that do not resolve, any breastfeeding situation that does not resolve within 24 hours. DBEs operate under a separate scope of practice for their profession. The DBE also makes appropriate referrals to medical professionals, nutritionists, hospital nurses, social workers, etc., for situations beyond their scope of practice. DBEs refer mothers to peer counselors for support and basic breastfeeding assistance. Peer counselors are part of a full team of support for WIC families who each refer to one another as needed to help mothers meet their goals. Supervisors should work with clinic staff and peer counselors to develop a realistic plan for how referrals should be made and when. Our local agencies have a variety of solutions for making referrals: paper referral forms, the WOW system, emails, and phone calls. Each agency needs to clearly define their referral system and ensure that all members of the clinic staff are aware of the system. This will ensure no mother or baby is missed. Phone, text, or email protocols should be developed for peer counselors working outside the WIC clinic setting and hours. Program managers can help prevent scope creep from occurring among peer counselors. Scope creep can occur as a natural process of growing skills, when peers do not have access to a qualified expert, when scope of practice is not discussed, when peer counselors are not well supervised, and when clinic staff make inappropriate referrals to peer counselors for lactation issues that are beyond the peer counselor scope of practice. It is the responsibility of supervisors to mentor peer counselors in the early days of their job and to monitor their contacts to help them stay within their scope. Train peer counselors before allowing them to contact WIC participants. Share examples of situations that should be referred. Determine a systematic approach for making referrals. Provide peer counselors with names of referral sources and appropriate situations when referrals should be made. Review expectations frequently and at monthly staff meetings. Review and discuss the peer counselor's documentation of contacts. Praise peer counselors when appropriate referrals are made. Share case examples during staff meetings. maintain ongoing communication with peer counselors. Peer counselors should refer situations that are beyond their training. This includes common problems that do not begin improving within 24 hours of the intervention, or when there are medical situations for the mother or infant. Referring these situations is imperative in reducing liability risk. The referral concept used in the peer counselor training is called yielding. Some situations require a peer counselor to smoothly hand off or yield a mother to more experienced professionals. Merriam-Webster defines yield as to give place or precedence, acknowledge the superiority of someone else, to give way to become succeeded by someone or something else. To yield does not mean the peer counselor tells the mother to call the DBE. The peer counselor should make an immediate, direct referral for help. Peer counselors continue to contact the mother to support and encourage her while others assist her. When to yield lists general situations addressed in the peer counseling curriculum that normally should be yielded to the DBE or healthcare provider. This is not an exhaustive list. A situation that a peer counselor finds uncomfortable or one that lies outside her scope of basic information and support should be yielded. The following is a list of questions that the breastfeeding peer counselor can ask herself to help her decide whether or not to yield. It is suggested that these questions be discussed with a new breastfeeding peer counselor early in her training and reviewed regularly. Did I learn how to manage this in my peer counselor training program? Is this skill listed in my job description and scope of practice? Is this in my when to yield list? Maryland WIC documents breastfeeding peer counselor contacts in the WOW system. This is included in the breastfeeding peer counselor training, but should be reviewed in detail in each local agency, especially regarding referrals. Documenting all contacts with mothers is an integral part of the peer counselor's job duties. Documentation provides a record of the advice given, the method to refer problems to appropriate WIC staff, the measurement for effectiveness, the plan for follow-up care for the mother and baby, and provides an opportunity to monitor peer counselor activities. They document all contacts, information covered, and referrals made. In WOW, our electronic documentation system, supervisors spot check participant contacts to review education provided and referrals made. Peer counselors are responsible for securing all documentation they record away from the WIC clinic. Agencies should discuss with peer counselors the methods required by their agency to keep the mother's information confidential and protected. If a computer is provided, peer counselors should be trained to close down the computer so that a mother's information is not readily visible to other family members or individuals. Many agencies require that supervisors conduct spot checks of peer counselors who work outside the clinic environment. This verifies the contact and assures that mothers are receiving appropriate assistance. Reviewing electronic records on a periodic basis is also a way to spot check the work of peer counselors. As peer counselors grow their knowledge, skills, and experience beyond the basics, many WIC agencies provide career path options to keep peer counselors engaged and to allow them to expand into other realms of service that benefit from their expertise. Research shows that career ladders help increase retention of peer counselors and give them positive goals to work toward. In some agencies in Maryland WIC, senior-level peer counselors have worked as entry-level peer counselors for at least 2 years, have received additional training, and have recognized skills in breastfeeding support. Each agency will need to determine policies for advancing a peer counselor to a senior position. Please refer to the Maryland WIC job description, Senior Peer Counselor, for a more detailed list of job duties. These can include assisting with training new peer counselors, assisting with mentoring new peer counselors, teaching classes and support group meetings with WIC mothers, receiving referrals of situations that do not require yielding to the WIC designated breastfeeding expert, assisting the peer counselor coordinator with the program. The Maryland WIC program offers senior peer counselor training. Please contact the State Breastfeeding Peer Counselor Program Coordinator for details on upcoming training opportunities. A WIC peer counselor says, "I love my job. Breastfeeding support here at this clinic is great. The more I'm here, the more I learn. I'm so fortunate to have a senior peer counselor to help me show me the ropes, and the DBE here is fantastic. I turn to them all the time, and I learn so much from them." This concludes Section 6, Scope of Practice. Please continue on to Section 7, Practice Settings for Peer Counselors. Thank you for your participation in Loving Support Peer Counselor Training for WIC managers, coordinators, and supervisors.